What if I told you that the very pill you take every morning to feel better might actually be quietly harming your brain? It could be something as simple as your allergy medication, your sleep aid, or the pill you take to calm your nerves before bed. Recent studies have found that some of the most commonly used drugs by seniors are linked to up to an 80% higher risk of memory loss and cognitive decline. And the scariest part? The signs are subtle at first. You forget where you put your keys. You mix up names. You get lost driving to a familiar place. You might think it's just aging. But what if it's not? Today we're going to uncover 9 medications that could be silently affecting your brain, and more importantly, what you can do to protect your memory starting today. Have you or someone you care about experienced unusual forgetfulness lately? Share your thoughts in the comments. And if this topic hits close to home, hit the subscribe button and ring the bell, because your health deserves your full attention. Let's begin. And if this topic hits close, 1. Opioids, pain relief. That comes at a mental cost. Pain relief or memory thief? That's the question we need to ask, especially for seniors who've been prescribed opioids for months or even years. Opioids like oxycodone, morphine, or hydrocodone are powerful painkillers often given after surgery, injury, or for chronic pain. But here's what most people don't realize. Opioids don't just dull physical pain. They also affect your brain's ability to connect and process information. Over time, these drugs damage the white matter in the brain. Think of it like the communication wires that help different brain regions stay connected. As this wiring weakens, thinking becomes slower. Memory feels foggy. And for older adults, this mental dullness can appear much faster than in younger people. In fact, one major study found that long-term opioid use can increase the risk of cognitive decline by up to 40%. The tricky part is, the signs can be easy to dismiss. You might feel sleepy more often, forget small things, or struggle with focus. That's why we always remind our patients, opioids should never be a long-term solution without regular reevaluation. If you're dealing with chronic pain, ask your doctor about alternative options, like physical therapy, acupuncture, or guided movement therapy. Many seniors have seen real improvement using these approaches without the mental side effects. Your brain matters just as much as your body. Don't ignore the signs. Have you or someone you love taken opioids for pain? How long have you used them? Let us know in the comments. Have you or someone you love taken opioids for pain? And if you think opioids are concerning, wait until you hear about the next medication, commonly used for anxiety and sleep, but with even deeper effects on your brain. Stay with us. 2. Benzodiazepines, anxiety relief. That clouds your brain, calming the nerves or numbing the brain. That's the trade-off many seniors are making without even realizing it. Benzodiazepines, commonly known as benzos, are medications often prescribed to treat anxiety, insomnia, and even muscle spasms. Some familiar names include Valium, Ativan, Xanax, and Restoril. These drugs work by enhancing the effect of a neurotransmitter called GABA, which slows brain activity to create a calming effect. And for short-term use, they can be helpful. But the problem starts when they're used every day, sometimes for months or years. Over time, this slowing of brain activity can affect much more than just anxiety. It can lead to confusion, memory problems, slower reaction time, and even disorientation. In fact, studies have shown that long-term use of benzodiazepines increases the risk of Alzheimer's disease by 32% to 80%, depending on the dose and duration. Many seniors are never warned about these risks. They're often given benzos to help with sleep, and before they know it, their brain feels slower, foggier, and harder to trust. That's why we encourage alternatives, especially for long-term care. Approaches like cognitive behavioral therapy, CBT, meditation, gentle exercise, and natural remedies like chamomile tea or magnesium supplements have helped many of our patients sleep better and feel calmer without compromising their memory. Have you or someone close to you ever used benzos to help with anxiety or sleep? How did it affect you? Let us know in the comments. And if you think these risks are serious, the next medication might surprise you even more. It's one of the most commonly taken drugs by older adults, often for something as simple as muscle ease. Let's take a closer look. 3. Muscle relaxants. the hidden sedative, a pill to ease your muscles, but also your memory. That's the hidden risk many people overlook. Muscle relaxants are commonly prescribed for back pain, arthritis, or muscle spasms, especially as we age. Medications like cyclobenzaprine, methocarbamol, or tizanidine are often taken without a second thought. But here's the catch. These medications don't just relax your muscles. They slow down your central nervous system too. And when your brain is told to slow down day after day, it starts to get used to that lazy rhythm. This leads to something we don't always notice at first. Mental fog, trouble focusing, slower reaction time, and yes, increased risk of falls and injuries, especially in seniors. You might think, well, it's just a mild sedative. But a 2020 study found that long-term use of muscle relaxants was linked to a 36% higher risk of dementia. That's not something to brush off. One of the biggest problems? Many older adults are still prescribed older generation relaxants like cyclobenzaprine for years, without reevaluation or knowing the cognitive side effects. So, what can you do instead? Plenty of our patients have found relief through gentle stretching routines, massage therapy, warm compresses, and even aquatic therapy. And the best part? These methods support your muscle health without compromising your brain. And next, we're going to talk about something many of us take for granted, the everyday allergy or sleep pill sitting in your cabinet right now. You may want to double-check the label after hearing this one. 4. First-generation antihistamines, allergy meds, with a cognitive price, one allergy pill, and years of lost memory. That's the unexpected risk hiding behind many over-the-counter medications. First-generation antihistamines, like Benadryl, diphenhydramine, chlorpheniramine, and hydroxyzine, are often used for allergies, colds, or even as sleep aids. They're available without a prescription, and many people assume they're perfectly safe. But here's the problem. They belong to a group of drugs called anticholinergics, which block the brain chemical acetylcholine, a vital messenger for memory and focus. Think of acetylcholine as your brain's communication system. When levels drop, your brain starts to slow down, leading to confusion, forgetfulness, and eventually, cognitive decline. In fact, a study published in JAMA Internal Medicine found that long-term use of strong anticholinergics increased the risk of dementia by 54%. That's a serious number, especially for medications we often take casually, like a nighttime allergy pill. What's even more concerning is that many people use these medications daily before bed, thinking they help with sleep. So, what can you do instead? Luckily, there are safer alternatives. Second-generation antihistamines like cetirizine, Zyrtec, or loratadine, Claritin, don't cross the blood-brain barrier as easily, so they have a much lower impact on cognitive function. If allergies or sleep problems are a concern, ask your doctor or pharmacist to help you switch to a brain-friendly option. And now, let's move on to another group of drugs that may be hiding a mental cost. Sleep aids known as Z-drugs. They may help you fall asleep, but at what price? 5. Sleep aids, Z-drugs, sleep now, forget later. Sleeping well, or sedating your brain to forget faster. That's the uncomfortable truth behind many common sleep medications. Z-drugs like Zolpidem, Ambien, Azopiclone, Lunesta, and Zaloplon, Sonata, are widely prescribed to help seniors fall asleep. But while they might help you drift off quickly, they can seriously disrupt your brain's natural sleep cycle, especially the REM stage, where memory consolidation and brain repair happen. Think of REM sleep as your brain's file organizer. When that process is blocked, your memories aren't stored properly. And even after 8 hours in bed, your brain may wake up feeling foggy, forgetful, and out of rhythm. A 2019 study published in the British medical journal, BMJ, found that seniors who used Z-drugs regularly had a significantly higher risk of developing dementia. And it's not just about memory. These medications have also been linked to sleepwalking, confusion, and an increased risk of falls, which can be life-changing or even life-threatening for older adults. So, what's the alternative? Many patients have found success using natural methods to improve sleep, keeping a consistent bedtime, exposing themselves to natural morning light, avoiding screens before bed, and for some, taking low-dose melatonin. These approaches help the body follow its natural rhythm, which supports both better sleep and sharper cognition. Have you ever taken a Z drug or prescription sleep aid? How did it affect your memory or energy the next day? Share your experience below. We'd love to hear. Just like sleep aids, the next medication is often taken daily, yet few know it may block brain nutrients, but studies show it may be robbing your memory while treating your stomach. Let's talk about it. 6. Proton pump inhibitors. Silent saboteurs of brain nutrients. Your stomach feels better, but your brain may suffer. That's the hidden cost of a class of drugs many seniors take daily, often without realizing the risk. Proton pump inhibitors, PPIs, like omeprazole, Prilosec, pantoprazole, Protonix, and esomeprazole, Nexium, are widely used to treat acid reflux and heartburn. They work by reducing stomach acid, but they may also block your body's ability to absorb vital nutrients, including vitamin B12 and magnesium. Why does that matter? Because B12 is essential for brain function, nerve health, and energy levels. Low levels of B12 can lead to confusion, fatigue, memory loss, and even brain shrinkage over time. A major German study involving over 73,000 seniors found that those who used PPIs regularly had a 44% higher risk of developing dementia. The tricky part, many people take these medications for years without rechecking their necessity or monitoring their B12 levels. They may feel better in their stomach, but may not realize their brain is slowly being starved. If you or a loved one uses PPIs regularly, consider this a gentle nudge to talk to your doctor about periodic B12 checks. Simple blood tests can catch deficiencies early and prevent long-term damage. In many cases, dietary changes, elevating your bed, or using safer alternatives like H2 blockers, for example, famotidine, may help reduce reflux without depleting your nutrients. Next, let's explore another class of drugs that may seem like they help, but might actually accelerate the very condition they're supposed to manage. 7. Statins. Heart protection. Brain confusion. Lowering cholesterol at the cost of your memory. Statins have been life-saving for millions, but are they silently confusing your brain? Statins like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, are some of the most commonly prescribed drugs for seniors. They help lower cholesterol and protect against heart disease. But here's the catch. Your brain needs some cholesterol to function properly. In fact, the brain contains about 25% of the body's total cholesterol, which is essential for maintaining neuronal connections, the very pathways that allow you to think, remember, and focus. Statins, especially in high doses, may lower cholesterol in the brain, disrupting these connections. They also reduce levels of coenzyme Q10, CoQ10, a nutrient that helps brain cells produce energy. Without enough CoQ10, the brain can feel tired, foggy, or even depressed. One study published in Pharmacotherapy found that 75% of statin users who experienced memory issues saw improvement after stopping or reducing the drug. That doesn't mean statins are bad, but it does mean they're not one size fits all. If you've noticed memory problems or mental sluggishness after starting statins, don't stop the medication on your own. Instead, talk to your doctor about trying a lower dose, switching to a newer generation statin, adding a CoQ10 supplement. Every person's body and brain respond differently. And balancing heart health with cognitive clarity is possible with the right guidance. Coming up, a drug that's sometimes used to calm the mind, but might actually be accelerating mental decline. Let's talk about antipsychotics. 8. Antipsychotics, the irony of memory suppression. A pill to calm the brain, that might be erasing it. That's the heartbreaking irony of antipsychotic medications often prescribed to seniors. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, are designed to reduce agitation, anxiety, and extreme mood swings. But they work by blocking dopamine, a neurotransmitter that plays a key role in motivation, emotion, and memory. When dopamine levels drop too low, the result can be emotional numbness, apathy, and, most alarmingly, accelerated cognitive decline. In fact, the FDA has issued a black box warning on the use of antipsychotics in elderly patients with dementia, citing an increased risk of death. Even in those without dementia, long-term use has been linked to faster memory loss and dependence on the drug to function. This becomes especially dangerous when a person who is already showing signs of forgetfulness is prescribed these medications to calm them, only for their confusion to worsen. We've seen many seniors become withdrawn, struggle with simple tasks, or lose their sense of joy, not because of their illness, but because of the medication. So, what can be done? For some seniors, behavioral therapy, a supportive daily routine, and a safe, peaceful home environment can reduce agitation naturally. These changes might not replace medication entirely, but they can reduce reliance and give the brain a better chance to stay clear and connected. Have you ever seen someone become more withdrawn after starting a new medication? Share your story in the comments. Your insight could help someone else recognize the signs. And now, let's move to the final drug on our list, a medication group that combines several risks into one, and might be hiding in your cold or sleep aid cabinet right now. 9. Tricyclic antidepressants, the overlooked cognitive risk-fighting sadness by fading memory. It's a trade-off that too few people realize they're making. Tricyclic antidepressants, like amitriptyline, imipramine, or nortriptyline, are older medications still prescribed to treat depression, nerve pain, or insomnia in seniors. While they can offer relief, they also come with a hidden cost. These drugs work by blocking acetylcholine, a key brain chemical involved in memory and concentration. This is the same neurotransmitter affected by first-generation antihistamines and some bladder medications. When acetylcholine levels drop, patients may experience daytime drowsiness, mental fog, trouble focusing, and eventually, long-term memory decline. A landmark 2015 study published in JAMA Internal Medicine found a dose-dependent relationship between tricyclic antidepressant use and dementia risk. In simple terms, the higher the dose and the longer the use, the greater the danger. Yet many seniors stay on these medications for years without being informed about safer, more modern options. Today, newer antidepressants, especially SSRIs like sertraline or escitalopram, are often better tolerated by aging brains. They may still have side effects, but they tend to be less harmful to cognitive function over time. Here's our suggestion. If you or a loved one are taking a tricyclic antidepressant and you've noticed mental sluggishness or forgetfulness, it may not be just aging. It could be your brain asking for a second opinion. Depression is real, and your mental health matters deeply. What helps you feel better on hard days? Is it a walk in nature, a talk with a friend, or simply journaling your thoughts? Share below. We're listening. And now, let's wrap things up with a few powerful takeaways and how to protect your brain moving forward. So, now you know 9 commonly prescribed medications that could be silently harming your brain. But this isn't a message of fear, it's a message of awareness, of empowerment, and of hope. This doesn't mean you should stop taking your prescriptions right away, but it does mean you have the right to ask, is this drug still the best choice for my brain? Are there safer options that support both my body and my memory? The truth is, the earlier you act, the more you can protect. And the brain is more resilient than we often believe. Many seniors have seen mental clarity improve just by sleeping better, eating nutrient-rich foods, staying active, and working closely with their doctor. Here's one simple change. Try adding blueberries, fatty fish, and leafy greens to your meals. Just 3 servings a week can help sharpen memory and reduce inflammation. And maybe someone you love is quietly dealing with these side effects without even realizing it. Send them this video just in case it helps. If you found this video helpful, please give it a thumbs up. Leave a comment below. We'd love to hear your thoughts. And tell us what topic you'd like us to cover next. And don't forget to subscribe and turn on notifications so you never miss a tip to protect your mind, your body, and your independence. Stay strong, stay sharp, and we'll see you in the next one.